The first hour after a burn is usually known as the golden hour. And whatever action we take within this hour determines if we can save a life or prevent them from having a longer stay in the hospital when they have a burn. Welcome to the First Aider Show, where we seek to empower ourselves with basic first aid skills to save life, preserve life, and to help ourselves or the conditions we're in from not becoming worse or even worsening before we get enough medical help. And today we are going to discuss about burns. I'm your host, Onyango Daisy Awor. Joining us in the show is Dr. James Okeyo, who's an expert in this field, and he'll be telling us more about burns. What are the causes? What are the types of burns? What do we need to know about burns, and what we should do when we are talking about burns? Daktari,
yes,
welcome to the show, and thank you very much for being here with us.
Thank you.
And I would like to ask you, what are the types of burns that are there?
The types of burns, we have 3 types of burns. Mm-hmm. And we normally classify them according to the skin structure.
Okay.
You know, our skin is being structured 3 times. Mm-hmm. We have epidermis, tissue. Mm-hmm. I think if you can remember your biology.
The 3 layers.
Yeah, the 3 layers.
Yes.
Epidermis, we have dermis, and subcutaneous tissue. Deep inside.
Yes.
So sometimes we can call this a superficial burn or a deep burn.
Okay.
It depends with the layer. So first we have epidermis burn, dermis, and superficial.
Okay.
Yes.
And what are some of the causes of burns, or even all the causes of burns?
Yes, what can cause burn? It's normally heat. We have open flame. You can be burned by open flame. You can be burned by friction. Do you know friction?
Yes, but I don't get to understand
when
how.
We call it friction burn. You fall down, that friction.
Okay.
Yes, you can get a burn by that one.
Oh, I thought that was only bruises?
No.
Okay.
There are some times
that are burns.
We treat them like burns.
Okay.
Because, you know, there is no bleeding. Yeah, it's just a burn. You know, burn, when there's no bleeding, that's a burn. So sometimes it is called superficial burn.
Okay.
So friction. You can get burned through chemicals. You can be burned by chemicals, electricity, a shock.
Okay.
You can be burned. So there are so
I thought
many.
when you're electrocuted, you become like steel, or those are just movies.
They normally, have you seen somebody who has been electrocuted?
Not really. I've seen them in movies, but not in real life.
Okay, you'll see one, or one day you'll get burned by electricity.
No, I
yeah,
don't
you
want
can.
to get burned
If I
by
say
electricity.
the iron box.
Oh yes, I actually have an experience with that.
Yes, that's
when I was
burn.
a little bit younger.
So you can be burned by electricity.
And okay, with that experience, I had this something that was swollen. I don't know if it was water or what. How do we call that?
Water.
You know when the iron box burns you, and then there's something, like a small layer of your skin that forms.
Yeah, that's
and
a
it's
burn.
Swollen.
It is a burn. So there is accumulation of fluids inside there. That's a burn.
Okay.
Yes.
And these burns, do they come with blisters, or some of them are just the open wound when your skin has been peeled off?
Yes, it depends with the degree of burn.
Okay.
Some come with blisters, some do not.
And you talk of degree of burns. How do you determine the severity of the burns with the degrees?
Yes, with the degree, there's a rule. You know, each and everything that you do, even you can remember your physics, the rules. So there's a rule called Wallace Rule of 9.
Wallace Rules of 9.
Yes, whereby, so these Wallace Rules of 9, we classify the degree of burn. And I think when we'll be demonstrating, we'll show you how to classify the degree of burn using our demi or a walking demi that we'll be using to demonstrate.
Viewer, if you're just joining us, welcome to the show. We are talking about burns today, and we've just learned that some of the causes of burns are heat, friction, there's electricity, there's open flame that can cause burns. And also there are 3 types of burns that can be there. There's one on the epidermis,
Yes.
on the dermis, and there's
Subcutaneous.
burn in the subcutaneous tissue.
Yes.
And with us here is Dr. James, and he's continuing to tell us more about that.
Yes.
So I had one more question.
Yes.
Not just one more, I have a number of questions.
Yes.
You talked about having blisters with burns. How long do these blisters blister burn? How long do they last?
It depends with the treatment. Once, a burn, this is now an open wound, open skin.
Yeah.
And in our skin, there's something called normal flora. Have you ever heard?
No, I've never heard of that.
Normal flora, it's it is like an agent to prevent you not to get infection.
Okay.
But once you've burned the normal flora in our skin, you can get infection.
Okay.
So it depends how the management and how soon are you going to treat that burn.
Okay. You've talked of infection. Does that mean that with our burn, we can also get an infection?
Yes.
How does an infected burn look like?
Infected, you will see the oozing pus. You will see the pus. There are some fluids, it will be always wet. So when you are treating burn, you have to give antibiotic to cover for infection.
Okay.
Yes.
And there's usually a lot of pain
Yes.
with this burn.
Yeah.
How do you reduce the pain or calm the pain?
Okay, reducing the pain, you reduce by giving a painkiller. But there are some burns when you give up, there are so many functions of the skin. Because, skin, it also protects us to lose the heat of our body. But when there is a burn, there is what? There is a damage of the skin.
Okay.
So we lose more heat in our body so that you can go to a situation called hypothermia. Hypothermia. So we normally encourage people or the victims, we don't give them painkiller or we give them a painkiller but not paracetamol. So many people, they normally give paracetamol. We have an analgesic and a painkiller. So that's the reason why when you have a high temperature, you are being given paracetamol so that the temperature should do what?
Should calm down.
Just imagine you have a burn and I'm giving you a painkiller for your temperature
to go down.
You get the point?
Yes.
Yes. So you just give analgesic.
Okay.
Yes, for the pain only.
And there's this rumor that urine is very good for burns. How true is this rumor? And also toothpaste.
Okay, even me, I've heard about it, but medically is not proven that urine. Urine is a waste, excrete from our body. So these are myths, but these myths, they sometimes normally work.
Okay.
So I can't support that. With the toothpaste, I don't know, but it's not medically proven that it works.
What is the right medical procedure of treating burns just before you get to the hospital?
Yes, the first aid that you're supposed to do for the victim, there's something called ABC in first aid.
ABC, what is ABC?
ABC, first of all, before you start the ABC, we've been having various sessions of discussing. You check of surrounding. Maybe this one is fire. This person has been burned. You have to take care of yourself first. So you check the danger, whether there is a burning somewhere. So if you are safe, go to this person. A stand for airway. You look for the airway of this person. The nose. Is the person breathing? And all these things, you listen, you feel and touch.
Listen, feel, and touch.
Yes.
How do we listen? How do we feel? touching, at least I know you
Yes.
touch someone.
If
try
you
to lift
listen,
them up.
if you listen, can you listen for me if I'm breathing? Are you listening?
But that when you're breathing.
Yes, you are listening.
Yes, I'm listening.
And feeling, you'll put your,
Okay.
yes, and touching, you'll touch me.
Yes.
You'll touch my
Touch your
chest.
chest to see if
Yes.
you're breathing.
So the airway, you'll see if the airway is open. B is to check the breathing. We've talked about the breathing.
Yes.
C, the circulation. You'll see whether this person, we talked about the pulse. Do you remember?
Yes.
Yes.
You can check it through
You
here.
can check it through here, very good. And another one?
Through the
Jugular, very good.
jugular vein.
Yes.
And the third one, yes, you put your head on somebody's
Yes,
chest.
you listen.
Yes.
I told you feel, listen and touch. Yes. So you can do all these things. So once you've seen this person, and then maybe you check also the tongue, the position. Because this person, whether it is conscious or unconscious, you need to place him sleeping with the side. Because the tongue can also block the airway.
Okay.
Yes.
And what if maybe the hands are burnt and I need to put this person on the side? How will I put the person on the side yet there are injuries already on the hands?
This one I'm talking about a serious burn.
Okay.
But you know there are some burn, you can be burned even you need to know to check the airway, the breathing, the circulation. This is a situation whereby this person is unconscious. Yes. But there are some, the normal burn for a person, you don't put a bandage. You should not, superficial on any burn, there's a drug we apply. We call it dummies.
Dummies?
Dummies.
Is it only found in the hospital or can it be bought?
And another, we know drugs, we have genetic and company name. We call it silver sulfur dioxide.
Silver sulfur dioxide.
Yes. So the name that you can know it is dummies. Dam relate with the skin.
The skin, yes. The second layer of the skin.
So the dummies you should have it
in the first aid kit.
In the first aid kit.
Viewers, if you're joining us, we have been talking about burns and we've discussed the types of burns, the causes of burns, what to do when there is a burn. And there's this rumor that, urine and toothpaste is good, but it's a myth. Medically, it's not medically proven. But we are going for a short break, and when we come back, we'll do a practical example of how to determine the degree of burns, and we'll also discuss more about burns because it's wide. We are talking about burns from electric shock, burns from fire, flames, friction, and we have more lined up for you, so stay tuned and do not touch that remote until we get back. Welcome back, viewer, to the First Aider Show. And today we've been talking about burns. We've discussed the types of burns, the causes of burns, and the degrees of burns. And right now we want to talk about how to determine the severity depending on the degrees. When you hear about 60%, what do they really mean? And how do they really determine what these burns are? And after that, we are also still going to talk about more about burns, what you need to do when someone has experienced a burn in the house. And I'm your host, Onyango Daisy Award. With me is Dr. James Okeyo. And we also have a casualty who will be used to demonstrate whatever it is we are talking about. Daktari, how do we determine the severity of burns? When people talk about degree of burns, what do they really mean? And how is it determined? Okay,
degree of burns is, I told you there's a rule.
Yes, the three-layer rule.
Wallace rule of 9. You can remember?
Yes.
Yes. So the degree and severity, they're just the same thing. So if you want to know the degree of burn of a person, because it will determine whether this person should be admitted or not. But you know, this one, we're just doing it for the sake of people to learn what does it take. But it's not necessarily you do you classify or you want to know the degree of burn at home. So this one is like we are doing it for people it's just a basic knowledge.
Okay.
Are you getting the point?
Yes.
Because that degree of burn, it will help you to calculate the amount of fluid the person needs. So this degree, it will help you to calculate the what? The fluid.
The fluid.
So for the sake of the viewer, you need just to learn, just to know how do we calculate that one.
And
So-
I would like you to show us how we do
Yeah,
that.
so before I told you,
We take our gloves.
Our gloves. Everything you start, you know, before you do anything, any first aid,
You must always protect yourself
yourself first.
and also take care of the patient that you're with.
Yes. So you put on the gloves. I'm seeing now you are trying.
Yes, I am learning. I am becoming an expert in this.
Exactly. So the degree of burn, how we calculate, I told you it is rule of Wallace, rule of 9.
Wallace rule of 9.
Yes. So if you want to calculate, let me say this person has a burn, this one, the whole face,
On the face.
the whole body, like this. So you want to calculate, and you will appreciate. So the face, it is always 90%. The whole, all of this. This is 4.5, 4.90%.
The whole face is
Yes.
90%.
Not 90, I mean 9%.
Okay, 9%.
9%. Are you getting the point?
Yes.
And then this is the chest, the upper, this one and this one. It is 9 and 9. 9 times 2 is
18.
18. So this is 9, this is 9.
Yes.
When you come to the abdomen here, it is also 9. This is 9, this is 9. That is
Wait, you both sides or?
it's 18.
Okay, 18.
Here is 18.
18.
18.
9.
That's how much?
Oh my God.
36.
No, 45.
45.
Yes.
Very good. And then this one is 9. This one is also 9. That's how much?
50, not 52.
64.
64, yes.
64.
Yes.
There is 9. That's how much?
73.
Here is 9.
82. Oh, 81. Oh, I should go back to my maths.
Here is 9. Here is 9.
Another 18.
That's 80?
No.
81.
Yes.
Plus here is 9. 80?
80. No, 90.
90. Here is 9.
99.
99.
Yes.
Always we call this place reproductive area. It is always 1%.
1%.
Yes,
Okay.
burn.
So let's go over it.
So
again.
that's how
That's 100.
100%.
9,
Yes,
9, 9,
yes,
9, 9,
yes,
9,
yes,
9,
yes,
9,
yes,
9,
yes,
9,
yes,
9. That
And
brings us
one.
to 99
Yes.
and 1%.
yes.
Okay.
Are you getting me?
Yes, I am.
So that's how you'll know the degree
Okay.
of burn.
So when they talk of percentage, it's because they've calculated
Yes.
depending on the nines.
Yes, 9, that rule.
And you talked about the ABC rule.
Yes.
Checking out if your patient is breathing,
Yes.
listening, feeling,
Yes.
touching. When our patient is burnt, how do we do that? Remember,
So-
they're also feeling pain, and maybe if you touch somewhere that is burnt, it might cause further injury or
Yes.
more pain.
Yes.
How do we handle that?
You know, when this person, it's burn, maybe it is a severe burn. We want to know whether this person, is he breathing? Because leave alone the pain. We are dealing with the life.
Yeah.
But the life of this person is the breathing.
Yeah.
We call it respiratory system, and cardiovascular system. So respiratory, those are the major things that you need to check on a patient, a victim who has a burn. So we check the airway. I told you, you look, feel, and touch. See, when you look for the airway, it is what? You normally
tilt the head.
You put the patient to lie on the side. You tilt the head like this.
Okay.
And what did I say the meaning?
Tilting.
Yes.
To open the airwaves?
No.
No.
Maybe the tongue.
Yes.
It's blocking the what?
The tongue is blocking the
airway.
airwaves.
Yes. So you try to open the mouth to check whether there's a foreign body inside. Okay?
Yes.
And then the nose. You can feel the breathing. You can even listen. Yes. After that, the airway. And then you go to the chest. You feel. You listen. You look. Can you breathe? So you can look, this person is breathing, he's alive.
Yes.
And then we go to blood circulation. Blood circulation.
The pulse.
The pulse.
On the palm.
If you want to check, I want you to appreciate, just wait. You use this one because even this one has a pulse.
Okay.
So it can confuse you. So can you press? Are you feeling something?
Yes.
Come here. You can even touch the
jugular vein. I know that.
Yeah, the jugular or Adam's apple.
Oh, for men.
For men. Can you touch? Are you feeling something?
Yes.
Are you feeling?
Yes.
Okay. The jugular vein is somewhere here. Yes, put it like that. Are you feeling something?
Yes.
You feel?
Yes.
Okay. So this one will show us that this person is still alive.
So this was the Wallace rule of 9 that we've been talking about. And I just want to ask, with the percentages that we've calculated, who is supposed to be admitted and at what percentage does someone get to be admitted at hospital because of a burn?
You know, I told you this one, we normally do it in the hospital, this calculation.
Okay.
But for the benefit of the viewer, you know, it's just a basic knowledge to know what is being done in the hospital.
Okay.
But more than 30%, we do normally admit.
Okay.
More than 30%, and it also depends with the severity of the burn. Okay. You know, a burn can be even 9%, but how deep is it? Are you getting my point?
Yes.
Yes. Maybe if it is superficial, it's okay. But you know, when it go beyond the dummies, that one is a deep, deep burn. Okay. We need to admit.
And coming to the house, you know, most of us, we have kids, they usually play around. And I was boiling water. And then my kid, you know, is curious, goes, spills the water, and it pours on her and she burns. What is the action I should take? The
action that you should take, you know, we talk about, say, some people, they use a toothpaste. Yeah. Some people urine. Some people maybe a flour. You know, these are just myths. Sometimes they work. You make to calm the child. You can, I told you, you cannot give a paracetamol. Most of people, they normally give a paracetamol, painkiller. If this burn has to occur, take the child immediately to the hospital. This one, you don't just handle the child very well and take the child to the hospital. Don't apply anything there. Even you can put maybe cold water, you can wash that place to be clean, but don't apply anything that can cause infection to this place where the burners are. And what about if I was cooking and you know sometimes the oil spills and you know, or you get burnt by a hot pan? What action can I take? You know, most of the time maybe we just put water and... Yes, what you can take, just go to the running water, tap. just put your hands and clean that place, and you can seek medical attention.
And for such a situation,
Yes.
Do we need to apply petroleum jelly, you know?
Not really. We don't. That's not, it's not, medical is not proven. I told you, when you have a burn, just wash that place with a cold water.
And seek further medical attention. Viewer, as we've learned, when you get a burn, do not be quick to use, you know, these other means that we always think are right. The first thing you're supposed to do is wash that place with cold water. Calm down first. Do not be quick and hasty to do, you know, things.
Yeah.
But wash the place with water and seek medical attention. And Daktari,
Yes.
what can we do to prevent these burns?
Basically, it is education. You know, all the things that we are doing, maybe cooking at home, we need to be very careful. You know, what you're handling is also dangerous to yourself. Like maybe the gas, the gas cooker we are using, they can blow out, they can burn you. You know, the water, the iron box. You don't be careless. It is a proper education, and you know, you see how to handle all these things. Yeah, those are the prevention that we can do. And there are accidents that don't normally occur.
Yeah.
You can educate, but accident can occur. Yes.
Thank you very much.
Yes.
Viewer, that was all we have for today. I know we've touched on very many things, and burns are wide, and a lot of things are included in them. And I hope that you've learned something from today. At least you know the Wallace rule of 9,
Yeah.
and how to calculate the percentage of the degree of burns. And also at home, when you've got a burn, do not rush to use, you know, urine, toothpaste, or other things. Just wash the place with cold water and seek further medical attention.
Yes.
Thank you for joining us today. We hope to meet you next time, next week, the same place and the same time. Thank you very much.